Childhood malnutrition remains a profound global challenge, disproportionately affecting children in low-resource and humanitarian settings. It is both a complex clinical and public health issue, necessitating multi-sectoral and context-specific interventions. Addressing this challenge is essential for achieving the United Nations Sustainable Development Goals, UN SDGs, and advancing universal health coverage, UHC. Numerous factors contribute to food insecurity and nutritional challenges, including conflict, socio-economic disparities, and inadequate living conditions. Climate change-related events, such as droughts and erratic rainfall, disrupt agricultural production, further jeopardizing food security and exacerbating nutritional risks. In addition, malnutrition in children can result from severe or recurrent acute infections and may be associated with conditions such as tuberculosis, chronic infections like HIV, and other chronic illnesses. Poor maternal health and limited access to quality perinatal care pose significant risks to both mothers and their newborns or young infants. Displaced communities and those affected by humanitarian crises face heightened health risks, including an increased vulnerability to malnutrition. A response to malnutrition begins with the early detection of undernutrition through community-based programs. This must be complemented by a comprehensive approach to managing malnourished children in both outpatient and inpatient settings. Post-discharge care and family support are critical, with a particular focus on addressing precarious living conditions to ensure long-term recovery and stability for children and their families. Guidelines from WHO, UNICEF, and humanitarian organizations outline context-specific strategies for the care of critically ill children with severe acute malnutrition, SAM, and moderate acute malnutrition, MAM. Recognizing the complexities of these challenges, this workshop will focus on the nutritional care of critically ill children, ages 1 month to adolescence, with and without malnutrition treated in low-resource and humanitarian settings.